Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you for joining us.
Well, thank you for having me on this program.
All right, let's begin with the COVID-19 guidelines. It's the 1st of December, and those guidelines are out, but there's some particular restrictions to Region 7. Could you tell us a little bit about those?
Well, as we normally would explain, we base these guidelines on the epidemiological situation that we have in the country at the time. And as you would see from our statistics, that in Region 7, that we've had a persistent increase in numbers. It has stabilized now around 62. And we'll continue to observe and to bring those numbers down. So that's why we have put the restrictions there. Once the numbers are down and we're satisfied, we have also made provisions for the minister to lift the restrictions. So once we are satisfied that things are okay, we'll be able to lift those restrictions.
All right, so the movement to the region, in and out of the region, what about movement within the region? How is that being monitored?
Well, the local law enforcement people would have to enforce those guidelines. When we talk about restriction of movement, as you would see from the guidelines, it clearly states that if you have non-essential business, then you shouldn't be traveling to those areas. So we want people to understand that. If you have some emergency, you have to go, well, okay, that's fine. But we want to reduce the amount of people going in and out of that area because of the potential for coming in, probably in contact with people who might be positive.
Okay. What about the infrastructure? Do they have everything that they need to deal with the positive cases?
Yes, so far. And what we've done, we have a number of persons who are in institutional isolation, and we have persons who are in home isolation. We also have established quarantine facilities there, so we have all the facilities that are necessary. And the medical team on the ground would decide which of these facilities to use as the case might demand.
All right, and just for clarity, in terms of the testing that's ongoing, we know that we have all the facilities set up in Region 4. How is that going?
In regards to testing, as of this week, we will start introducing antigen testing, which is different from PCR. PCR we regard as the gold standard. And when you take a swab from a patient, you'll have to send that swab to the laboratories. In this case, when you take the swab, you can perform the tests at the point where you're taking off the swab. And in some cases, these tests, depending on the type of test that you're using, they'll probably take about 20 minutes for you to do. In other cases, it might take a little bit longer. So what this helps us to do, it identifies the virus or fragments of the virus, and it allows us to get a better picture of what is happening with this patient rather than waiting for a 24-hour period, and then we'll get a result through PCR. So it gives us an immediate sense of whether this person has COVID or not. And this particular test is different from what we are accustomed to, because we have heard the term rapid tests, and rapid tests is normally associated with an antibody test. These tests are not antibody tests. They are testing for the virus or the antigen. So it really differs, right? And these tests would help us to determine whether somebody is infectious or not. Antibody tests generally are not able to do that. So we're adding these tests because it would allow the doctors and other healthcare personnel that is offering care at various health facilities to have something where they can check people immediately. It would also be used in our hospitals because a lot of times the doctors are a little bit skeptical about admitting patients because they need to know their status. And when you wait 24 hours, you have to put the patients in a transition area and wait until you're certain from the PCR. This would reduce that time because we would be able to test people, and if they're determined to be positive, then we can immediately isolate them. If they're negative, then we'll get them into the ward and be able to provide regular care for them. So we think this is going to help us to open up a lot of avenues. One, it's going to reduce testing time. And secondly, it would allow us to help the hospitals to return to some sense of normalcy. As of today, we have started training with the staff of the GPHC, and tomorrow we'll have training in the use of these antigen tests for all the other regions. And once we complete these trainings by Wednesday, the kits would be distributed when the participants come, so they will have kits to take back to their respective regions. We have so far procured enough kits that can last us for maybe a 3 to 4 month period, and we'll see how it works as we introduce this.
Okay, Minister. Can I ask you what was the cost for this initiative?
Well, it's cheaper than the PCR. A PCR test would normally take about 20,000 Ghana dollars or a little bit less. These tests would run us around $12 or so per test.
All right. Thank you. I just wanted to go back a little bit to Bartica. We know Bartica is vast. You have Upper Mazaruni, then you have the Lower and Bartica Central. How is the medical team that's going in? How are they dealing with that?
Well, we have teams that are situated centrally, meaning in the town itself. And we have teams that are mobile. So if there's a need to respond to an outbreak or they need to deploy people to go and do testing, they're able to send out those medical teams.
Okay. I have my final question to you was on the communities that we have been dealing with. Bartica is already covered. So what about Oriel and Siparuta and St. Cuthbert Mission? I know we've had reduction.
St. Cuthbert's, as you know, we lifted the lockdown over the weekend, and we continue, however, to monitor cases there. We now have 16 cases in St. Cuthbert's Mission, and we expect that during the week we'll have even less cases. But our team would remain there at least for another week or two to ensure that we have a thorough understanding before we leave. So that's St. Cuthbert's Mission. In terms of Oriala and Siparuta, at Siparuta, we've had about 49 cases, and in Oriala, we have currently about 31 cases. So that has not really changed from the last few days, and we will continue to monitor. Within 10 days or so, we start discharging people. Most of the persons who we have in isolation have been asymptomatic, so we expect that they would, remain for the next couple of days asymptomatic. However, if for any reason at all somebody develop any signs or symptoms, we're going to monitor that closely, and if it's necessary, we are going to bring those persons out to the hospital. We have had one case where we brought that person out to an isolation facility in Corriverton. So we have that capacity of moving people, bringing them out to Corriverton so that they can be closer to the hospital And if they need hospital care, we can easily provide that.
All right, thank you, Minister. As we get ready to wrap up, when we spoke last Friday, we spoke about World AIDS Day and we spoke about the PrEP drug, the rollout plan for it. Today is December 1st. I know you've already sent out a message, but what is key and most important for the nation to understand about this particular day? Why do we observe it?
Well, this day, as you recall many years ago, that HIV was really challenging for the whole world. And just like COVID, we didn't understand very much about HIV. And it took us a while to put together the research, to put together the financing, to start changing the course of the disease. We have been on a path now where we can actually end the AIDS. And the UN and a number of other global bodies have been working to achieve this aim. They had set some targets for this year, which is 1990 by 2020. And then subsequently, they have set a new target so that we can get closer to the elimination of HIV by 2030. Now, countries around the world has been working on this. The challenge that we now have is that some of the gains that we would have made over the last couple of years can be eroded because of COVID-19. And so patients who would have achieved viral suppression, patients who would have been receiving their medication, because of COVID-19, if they're not coming to clinics and so forth, their management can be compromised. And it's a challenging time. So what we have in effect is a collision of two pandemics, which is HIV and COVID-19. And if not carefully managed, a lot of our patients who are positive for HIV can have more difficulties with COVID. So it's something that we have to monitor. And while we navigate out of the COVID pandemic, we must also realize that we cannot compromise the things that we've been doing to end HIV and AIDS by 2030. So we have to keep on that path. And we in Guyana, we are committed to doing so. Later in the month, we'll be releasing a plan that goes for the next 5 years, looking at what we'll need to do over the next 5 years for HIV patients. We have also been doing quite a number of things, because one way you end a pandemic is that you have to reduce the amount of persons getting infected. And so with HIV, there's now a very good way of reducing infection, and that is using PrEP. That's pre-exposure prophylaxis. This is using antiretrovirals on patients who do not have HIV, but are at risk of getting HIV. And therefore, if these persons use PrEP, then they can prevent infection. And ultimately, that's what we want. We don't want people to be infected. So we are going to introduce PrEP across the country for all persons who are at risk. And you will see the rollout of that more comprehensively as we start 2021 and going forward. In addition to that, there are persons who are communities who are more vulnerable to HIV, and we'll be working more closely with those communities. One area that has been missing in our response to HIV here in Guyana is really to deal with transgender and transgender medicine. And so we've started making efforts to change that. And over this period, as we observe World AIDS Day, you'll be seeing a number of webinars and other activities relating to transgender medicine. There are, of course, other areas that we are looking at. We want to make sure that we are able to continue doing our testing providing treatment for persons who need the treatment. And you know, we have been doing that free of cost. So viral load testing and so forth, all these things, services we have been providing. We are going to continue to do that and ensure that our patients get the best care. So with regards to the 390s, the first one dealing with testing we have been able to accomplish. The second one, which has to do with treatment, we have not achieved that as yet. And that's something that we'll be working steadfastly on to be able to achieve because it's important for us to do that as we move this process forward. And the third 90, where we want to have patients who are on treatment to be virally suppressed, that is something that we have to work on. So the other thing that I think people need to know is that once we have somebody who is positive for HIV, but if they're virally suppressed, then they can't transmit the disease. So, you know, that's something that we want to work towards and to ensure that our patients get to that point where they're virally suppressed. So there are lots of work to be done, and over the years we have received lots of support from various partners. We have a number of NGOs here that have played an active role in raising awareness about HIV and AIDS, and has been in this fight over many years. And you know, we want to thank them for the work that they've been doing, and we want to continue that collaboration with them. We have some of the NGOs have been able to provide services, and we'll continue to work with them to be able to do so. We have had a number of international partners who has worked with us over the years as well, and the UNAIDS has been a very good partner to Guyana, and they continue to work with us. They have been working with us to ensure that we have our next strategic plan for the next 5 years. And again, we want to thank them for that collaboration and cooperation. We have also been working with the U.S. government, and as you know, we had the PEPFAR program here, and that too, we want to thank the people and the government of the United States for all the assistance they have provided to us over the years. So as we observe World AIDS Day, we are grateful for all the support that we have received, both internationally, bilaterally, and of course from persons locally. And we all need to pool our efforts, continue the efforts, so that we can work to finally stop AIDS or eliminate AIDS by 2030. So we still have a little bit more to do as we work to achieve that goal.
All right, Minister Anthony, again, thank you so much for speaking with us.
Thank you.
Well, that's it for today's COVID-19 update. We, of course, just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.